the station that's on your side. This is News 12 NBC 26 this morning.
Good morning, and thanks for joining us. We're taking a live look over beautiful downtown Augusta. And I have to say, I just got back from vacation, and I got so sunburned. I don't think you can see it so bad. My dress is covering it. But I have a feeling today is going to be a scorcher. Sunblock, hydrate. Is that kind of the case we're looking at today?
Same deal from what we've had all week, really just hot and humid conditions outside. Dangerous heat. You really don't want to be outside too long today at all unless you absolutely have to. Right now we're seeing temperatures in the upper 70s for most locations, low 80s up towards the lake. So it's already pretty warm this morning, and that humidity is definitely cranking outside. Very muggy as you step out the door around the CSRA. The lowest temperature right now, 73 up towards Saluda, our usual cool spot. Look at those heat index values, and already this morning we're seeing a few locations feeling a little warmer than what it actually is. Up towards the lake, it feels like almost 90 degrees. So that humidity is already having an impact on temperatures, and the sun has not even risen yet. So we're looking at another hot and humid day across the region. We do have a heat advisory in effect until about 8 p.m. this evening for those heat index values over 105 for some of our western counties, and we could even see some of those heat index values get close to 105, if not over, for those counties not shaded under that heat advisory. So pretty much a hot day for everyone, and those heat index values will definitely be causing a little bit of strife for some people outside. As far as current visibility, we're looking at a few areas of patchy fog around the region. Augusta's seeing some of the most dense fog right now. Thompson not too far from us at about 4 miles out of the possible 10. 5 miles of visibility down towards Louisville and Jefferson County, and then Screven County, Aiken, and also towards Sandersville and Washington County. You guys are seeing some patchy fog this morning as well. Your morning run and bike ride forecast just showing that chance for some of that patchy fog, but as we head towards 8 and 9 a.m. this morning, we should see that fog dissipate rather quickly, and then just some warm conditions as we head towards 10 a.m. and those temperatures close to the low 90s by midday for today. So a very warm day in store, and those temperatures rising quickly as well. We'll see high temperatures once again very close to 100, 98 degrees, the forecast high for the Augusta area, and most areas in the upper 90s around the entire region. A chance for a pop-up shower or storm, so that will be nice to help cool us off for sure. And then we'll see a muggy night in store, that southwest wind continuing to bring in more moisture across the area, so just staying very muggy overnight into tomorrow. We'll talk more about that forecast for the weekend and next week coming up in just a bit. Celeste.
Thanks, Mikkel. At two of our major hospitals, overcrowding is becoming an issue. Both of these pictures were taken last week at AU Health and University Hospital. You can see multiple ambulances lined up outside of the hospitals. The Georgia Coordinating Center, which sends ambulances to hospitals with available emergency rooms, shows AU Health and University are severely overcrowded. Will Rio talked to officials at both hospitals.
Well, they say this is something they haven't seen before. Our major hospitals on ER and ICU diversion, meaning they can't take any more patients right now. I spoke with an ambulance driver here, and she says that it's been absolutely ridiculous here. She says that they've had to wait 6 to 8 hours after dropping off patients. In emergency rooms across the CSRA, seats in the waiting rooms and parking spots for the ambulances are all taken.
I think all of the emergency departments actually, not only locally, nationally, are experiencing very, very high volumes.
This picture was taken yesterday at AU's emergency department. It's the new normal for our ERs in Augusta. Doctors say with COVID, not enough staff in general medical emergencies, they're bursting at the seams.
There's definitely been an increase in COVID coming in, and I think that's something that is seen throughout the CSRA. The volume of just sick patients in general has been very high in the emergency department.
Of our three major hospitals, AU and University are listed as severely overcrowded, so much that they can't take new patients in their ER or ICU.
We have probably not had the community as a whole on diversion as much as we are currently having.
The long wait times are tying up ambulances, some having to wait hours before getting back on the road. Hospitals are working to get tests and labs back as soon as people get to the ER.
We really try to turn around the EMS units as quickly as possible because we recognize that if they're tied up in the emergency departments, they're not out on the streets being able to help people.
Doctors say they need the community to do their part to help ease the number of patients coming through their ER.
If I could ask for one thing, it would be for people to go out, get immunized, to protect themselves and to protect those around them.
And doctors say it feels like everyone is in need of medical care right now. They're just spreading the simple message to make sure that everyone gets a vaccine. Reporting in Augusta, Wrdw on your side.
And the big concern here, while cases are rising, vaccine rates are not. But the fight is not over. Kennedy Harris explains how local health experts and community leaders are still pushing for more people to get the vaccine.
Well, we asked you on Facebook, if you have not gotten the vaccine, what's holding you back? Many of you said you were worried about the side effects. The vaccine coordinator for AU Health says most vaccine side effects appear within 6 weeks of the dose. Some people said they didn't want it because it wasn't FDA approved. Now, President Biden said just last week he expects FDA approval by the end of this year. And whether you have the vaccine or not, doctors say the rise should concern everyone.
As one battle ends, the next begins.
We're fighting an invisible war against, a lot of fractions of people, energies and minds where people think they don't need to take the vaccine. They think they can do without it.
Reverend Christopher Johnson is the director of the Greater Augusta Interfaith Coalition. Along with Medical Associates Plus and students from the Medical College of Georgia, his organization is pushing one thing across the county.
We go from town to town, community to community, trying to do vaccination.
So along with giving vaccines, they're also fighting hesitancy.
There are a lot of myths out there, and we try to combat the myth with truth. We try to combat the myth with trusted voices.
The current pandemic is really a pandemic of those that are unvaccinated.
Dr. Weish is the vaccine coordinator at AU Health. He says 97% of COVID hospitalizations are people who are not vaccinated. Over the past few months, he's seen the number of vaccinations drop and the hospitalizations rise.
We also know is that at the end of June in the United States, we were averaging under 8,000 cases a day of new COVID infections. As of last week, the nation is up to 65 to 66,000 new infections on a daily basis and trending up.
Dr. Weish says because of the rise we're seeing in cases, he expects more vaccine mandates will be put in place. And I spoke to a local constitutional rights attorney. He says it is legal for your job to require you be vaccinated. It would be considered a health and safety measure on the job.
Medical marijuana will soon be